Fowl pox in commercial broiler farming. Introduction. Fowl pox is a slow-spreading viral disease of chickens caused by the fowl pox virus. The disease affects the skin and sometimes the mouth, throat, and respiratory tract. Although mortality is usually low in the dry form, the disease can cause reduced growth rates, poor feed conversion, decreased productivity, and significant economic losses in commercial broiler operations. How fowl pox spreads. The virus is commonly spread through mosquito bites and other biting insects. Direct contact with infected birds. Contaminated equipment, feeders, and drinkers. Skin wounds and scratches. Scabs from infected birds, which contain large amounts of virus. The virus is highly resistant and can survive for months in dried scabs and contaminated poultry houses. How to recognize fowl pox. There are two main forms of the disease. 1. Dry fowl pox, cutaneous form. This is the most common form. Signs include small white spots on the comb, wattles, eyelids, and beak. Wart-like growths that enlarge and become dark brown or black scabs. Lesions on featherless areas of the body. Reduced appetite. Poor growth rates. Depression and weakness. 2. Wet fowl pox, diphtheritic form. This form is more severe and affects the mouth and respiratory tract. Signs include yellow or white plaques in the mouth and throat. Difficulty swallowing, gasping and labored breathing, nasal discharge, reduced feed and water intake, increased mortality in severe cases. Prevention of fowl pox. 1. Vaccination. Vaccination is the most effective prevention method. Vaccinate birds using the wing web method according to veterinary recommendations. Ensure vaccines are stored and administered correctly. Vaccinate replacement birds before exposure to mosquitoes and infected flocks. 2. Mosquito control. Since mosquitoes are major carriers, eliminate standing water around poultry houses. Cut grass and remove weeds. Use insect control measures where appropriate. Repair screens and prevent insect entry into poultry houses. 3. Biosecurity. Restrict unnecessary visitors. Disinfect equipment regularly. Isolate newly purchased birds before introducing them to the flock. Remove infected birds when possible. 4. Good management practices. Avoid overcrowding. Prevent injuries that can allow virus entry. Provide balanced nutrition and clean water. Maintain clean housing conditions. Treatment of fowl pox. There is no specific cure for fowl pox because it is caused by a virus. Treatment focuses on supportive care and preventing secondary infections. Supportive care. Provide vitamin supplements, especially vitamins A, E, and C. Ensure birds have constant access to clean water. Provide high-quality feed to support recovery. Control secondary infections. Antibiotics may be prescribed by a veterinarian to control bacterial infections that develop in damaged skin lesions. Clean severely affected lesions using recommended antiseptics if advised by a veterinarian. Managing an outbreak. 1. Separate affected birds if possible. 2. Improve hygiene and sanitation. 3. Increase mosquito control measures. 4. Remove and safely dispose of dead birds. 5. Thoroughly disinfect poultry houses after the outbreak. Economic impact. Fowl pox can cause reduced growth rates, poor feed conversion efficiency, delayed market age, increased medication costs, mortality in severe wet pox cases. Conclusion. Fowl pox is a common viral disease in poultry that can significantly affect broiler performance. Farmers can recognize the disease by the presence of wart-like scabs on the comb, wattles, eyelids, and beak, as well as lesions in the mouth and throat in severe cases. Since there is no cure, prevention through vaccination, mosquito control, biosecurity, and good management practices remains the best defense against the disease.